Hi, today I want to talk to you a little bit about a procedure known as kyphoplasty. Kyphoplasty is a procedure we perform for a very common diagnosis known as a compression fracture. A compression fracture is a fracture of one of your vertebral bones. We typically fracture a bone in our lower back, known as the lumbar spine, or sometimes in the mid-back, which is also known as a thoracic spine. When folks fall, generally on their tailbone or their buttocks, they land violently hard on the ground and the force goes through their spine and they generally develop a compression fracture or a break in one of these vertebrae here. We commonly see these fractures in our elderly patients, and they can occur from a minor trauma, a slip and fall, or even coughing. So how do we diagnose these fractures? We most commonly will order an X-ray in the office, which is very simple, and then oftentimes we need to follow this up with either a CT scan or an MRI. After we get a simple plain X-ray, we generally will confirm that the fracture is indeed new. So this is an example with an MRI. Again, in the lower lumbar spine, all of these vertebrae are very tall and very healthy. So as you follow the spine up, you can see that this is the very abnormal vertebrae that's significantly crushed at the T12 level, or the 12th thoracic level, from this patient's fall. Once we have determined that this fracture is indeed the cause of your pain, we can then discuss various different treatment options. We often try to treat the fracture without surgery if the pain is mild and if our patients are doing well. We can either use a brace, we can sometimes use pain medicines and rest, and simply let the fracture heal over the course of 8 to 12 weeks. If the fracture is very painful and is affecting your quality of life, you're having a difficult time moving around, then we will discuss the kyphoplasty procedure. Most typically, we perform the kyphoplasty procedure in office. It's done under light sedation, like you're at the dentist's office. The procedure itself takes about 10 to 15 minutes to complete, and patients go home right afterwards. There is very little aftercare or rehabilitation. We generally allow our patients to resume their normal lives. So these are now post-operative X-rays of the patient after they have had the kyphoplasty procedure. Again, you can see now that this vertebrae has been heightened, that there is this medical grade bone glue within the vertebrae, and what this bone glue does is it stabilizes this vertebrae from collapsing further. It allows the patient's pain to go away, but it also keeps their spine much more stable. So if you've been told that you have a compression fracture, or if you've developed significant low back pain even after mild trauma, come see us at Advanced Ortho and Spine and let us get you back on your feet again.